Hello, and welcome to theMSAG's next video in our COVID-19 series. We're continuing to look at different perspectives on the handling of the COVID-19 pandemic, sure to be a common topic during your medical school interviews. Interviewers will be looking for your opinion on this topic, so it's important that you understand all perspectives and can form a well-informed and balanced answer. In our last lesson, we examined the pro-lockdown arguments, that safety should be the utmost priority and that the spread should be stopped by all means necessary. Today, we will look at the contrasting viewpoint that freedom, the right of movement, and the right to work should be prioritized. Before we go into details, take a minute here to pause the video and write down some of the arguments you could think of about why lockdowns might not be the best way to handle the COVID-19 pandemic. Argument number 1. Freedom. The first argument against lockdowns is that they infringe on the democratic values of freedom and civil liberties. Equality and Human Rights Commission Chief Executive Rebecca Hilsenrath made a statement about the human rights implications of restrictions on people's lives due to the COVID-19 pandemic. We are walking a tightrope. We need to find the balance between saving lives from the coronavirus and allowing people the hard-won freedoms that are the framework for those lives, such as the right to a private and family life, to freedom of assembly, and to an education. There are many types of lockdowns and restrictions worldwide. Although restrictions have the aim of saving lives, there are still questions to ask and consider. Are authoritarian-style lockdowns, involving significant restrictions on freedom of movement and huge economic and social impact, the best way to tackle the coronavirus in democratic states? Some people were deprived of their family when they needed them the most. In the UK, schools were closed from mid-March 2020 to all children except the most vulnerable, and the children of key workers. Some age groups returned to school in June 2020, but a full return only happened in September of 2020. The Human Rights Act states that no person shall be denied the right to education, and it also states that everyone has the right to respect for his private and family life, his home, and his correspondence. Therefore, we must think carefully about the impact of restrictions. One of the most evident issues of restrictive measures is public compliance. Freedom of movement and civil liberties are deeply rooted values in many countries, and so heavy restrictions on these freedoms are problematic. Many countries such as Spain, France, and the UK had to apply a strict police presence to enforce restrictions. Argument 2. Lockdowns can encourage mass movement. The second argument against lockdowns is that they can, in contradiction to the idea, encourage the mass movement of people. The first major example of this was seen in Italy when the government placed 1/4 of the population into lockdown. Approximately 25,000 people quickly left the area and moved to the parts of the country that had fewer restrictions. A policy that started out with the aim of trying to limit freedom of movement, in this case, actually encouraged a mass movement of people. We live in a diverse and increasingly global world. Many people live and work in countries away from their home country or their family. National restrictions have caused difficulties for many people, as countries have not worked together on their guidelines. National lockdowns across the world caused thousands of people to try and cross borders to get home, and this caused pinch points at airports, train stations, and other border checkpoints. Again, this can lead to the sort of mass crowding that governments were trying to avoid. Argument number 3. Lockdowns are not sustainable. The third argument against lockdowns is that they are not a long-term solution. Dr. Tedros Ghebreyesus, the Director General of the World Health Organization, said in a statement that so-called lockdowns enabled many countries to suppress transmission and take the pressure off their health systems. But lockdowns are not a long-term solution for any country. A paper published in the Lancet Medical Journal explained that lockdowns are not a long-term solution. The main issue is that the immunity to coronaviruses does not last long, and reinfection is possible. Therefore, herd immunity is not possible to achieve with lockdown measures alone. After decades, no population in the world has herd immunity to diseases such as cholera, yellow fever, polio, measles, TB, malaria, or the plague. It's for this reason that lockdowns cannot be a long-term solution, and are, at best, a way of buying time before we can implement more definitive measures such as a vaccine. Another point is that some people disagree with lockdowns because they believe that other measures are more effective and less restrictive. The article that we just mentioned from the Lancet Medical Journal recommends that the most important response is a robust system for testing, tracing, and isolating people. It also suggests that an alternative to lockdown could be finding other ways to reduce social interaction. For example, decreasing interactions to a few repeated contacts will create social bubbles, as pioneered by New Zealand, and this can allow interaction while reducing transmission. Argument number 4. The ethical argument against lockdown. In our previous lesson looking at the arguments in favor of lockdown, we presented an argument that prioritizing safety is the morally correct thing to do. It's important that you're able to discuss different viewpoints and hot topics and ethics in your interview. You don't have to agree with all of the opinions, but it's important to be aware of them. And there is an ethical argument against the use of lockdowns during the COVID-19 pandemic. Is it ethical to implement lockdowns? Pause the video and take a moment to think about the ethical arguments both in favor and against a lockdown. Although the aim of the lockdown is to protect people, it potentially has harmful consequences. Dr. Alberto Giubilini, a senior research fellow at the University of Oxford, outlined these in his paper published in The Spectator. He argued that lockdown will inflict more harm on society than perhaps any other measure in our peacetime history, and that this damage may not be ethically justified. He references the fact that during the first lockdown, thousands of cases of cancer went untreated. 2/3 of adults with mental health problems reported a worsening of their condition, and the number of suicide and attempted suicide incidents surged up 60% from the previous year. He also mentioned the damage to the economy in the UK. The UK is in the largest recession on record, and he argues that recessions have a huge impact on public health, chronic disease outcomes, and mortality. Some skeptics ask this question: is it wise or fair to impose radical limits on the freedom of all with no apparent end in sight? Thousands of lives are being saved, but millions of young people are seeing their prospects sacrificed. As we've said throughout this lesson, it's important to be aware of different people's opinions. During the first lockdown in the UK, a YouGov poll found that 93% of the public said they were in favor of the decision. However, this statistic is not as clear as it first appears. There was disagreement about certain restrictions. 89% of people supported rules on wearing masks, 87% supported rules on working from home where possible, and 77% of people supported restricting gatherings to no more than 6. However, 56% of people were opposed to closing schools. There have been several anti-lockdown protests in the UK in relation to the COVID-19 pandemic. These protests were opposed to the national lockdown in April 2020. There were further protests in September 2020, with the establishment of local lockdowns in response to the second wave of virus cases in the United Kingdom. The United States has handled the pandemic differently to the UK and has not imposed long-term national lockdowns in the same way. President Donald Trump said the following in a press briefing at the White House: "It's important for all Americans to recognize that a permanent lockdown is not a viable path toward producing the result that you want, or certainly not a viable path forward, and would ultimately inflict more harm than it would prevent." Donald Trump is a highly influential politician, and whether you agree or disagree, it's useful to think about his view that a national lockdown would inflict more harm than it would prevent. In summary, we've discussed a few of the arguments presented by those against stricter measures of lockdown and social distancing as a response to the COVID-19 pandemic. You do not have to agree with these arguments, but it's important that you are aware of them. It is crucial that you give a balanced answer when discussing hot topics in your interview. Many of the arguments we presented have strong counter-arguments from those who feel that stricter measures of lockdown and social distancing are essential to protect the most vulnerable in society and to save lives. If you haven't already, please check out our previous video to view these arguments. Thank you for watching, and best of luck on your admissions.